Hello, let's continue with the infectious disease, HIV. HIV, one of the common topics on the question, and they may ask you about prophylaxis. Somebody just had a needle stick or suspected that an HIV or for HIV. Your next answer will be to give three drugs treatment, and those will be emtricitabine, raltegravir, and tenofovir. Those will be on the question. Usually, also you have to test them for HIV immediately after the stick, and then you have to test them after 6 weeks, 12 weeks, and 6 months. Of course, you have to go and also understand the screening HIV combo and confirm the test later on with the viral loads and PCR if it's positive. Routine screen, yes, they may ask you about some when to test for HIV. Everybody from age 13 to 64, regardless of risk. But patients on risk for HIV, they will need at least annual testing. They may have some questions when to discontinue or stop opportunistic infection treatment. Uh, like pneumocystic herniae, to the toxoplasmosis, and MAC infection. You stop the prophylaxis once the CD4 count more than 200. So you need to understand what's the use for CD4 count and what's the use for a viral load. Next question is what's the when to test for HIV, when to suspect HIV. You will suspect HIV in unusual kind of infections, viruses like unusual refractory herpes simplex virus, CMV with colitis or retinitis, herpes zoster that is refractory, unusual site, atypical, recurrent. Then you test for that. Some fungal infections or candidiasis, esophageal, oral thrush, pneumocystic herniae infection, Cryptococcus meningitis, disseminated mycobacterial infection, of course, toxoplasma, and some autoimmunes like severe seborrheic dermatitis or psoriasis. Psoriasis, one of the things that you need to test if they are new or severe, then you have to be those are to be tested. Treatment, usually once you diagnose them and you can confirm the diagnosis, you have to start with at least three antiretroviral therapy regardless of the CD count. So don't go and said if they already confirm the diagnosis and the test, they have this patient, this and that, and they said it's positive, and the next question will tell you, okay, treatment with three medication or two medication or one medication, and one of the options will be okay, do CD4 count or do viral load, then treat, or they're gonna ask you about start treatment. Yes, start treatment regardless of the CD4 count. The other thing you need to know, you're gonna start the treatment, but at the same time you're gonna do or run the resistance test, so you know the susceptibility for ART. How you're gonna monitor the response for antiretroviral therapy is by following them with the viral load. The viral load should tremendously drop after treatment, and of course you're gonna follow that every at the beginning 6 weeks, then 6 months. Um, you're gonna suspect treatment failure if there is no persistent detectable, if it's continued to have a detectable level of viral load, or you're not seeing the expected drop in the viral load during the follow-up, then you have to suspect failure or resistance. Then you have to redo the resistance test. So you may have this test in the question, you may have this question on the test, which is the patient came back, we still have a viral load is high. You need to make sure it's compliance, there is no compliance problem, and he's compliant taking his medication. The other question you need to know is there a resistance or failure to the treatment. For follow-up with a CD4 count, it's helpful to decide when to stop the antibiotics for opportunistic infections. Syphilis.